I'm Billy Eden, and I'm a sleep physician with Trinity Clinic Sleep Medicine. I'm originally from Duncan, Oklahoma. They had a very good family-oriented community. Halliburton was a big part of the community, and they were very involved in pretty much everything in Duncan. They had a very good school system, or at least I thought it was a very good school system. I enjoyed being there. We had fun as kids. You could run around the streets and not really have to worry about any sort of malfeasance or bad things happening to you. And generally, I would say it was a very good community to grow up in. I would say my mother and father both had the greatest influence on my life equally. I think both of them had a very strong work ethic. I always felt that it was important to care for other people, and that was a big part of our life. My mom had clothing stores, and I remember there were lots of times when, we would give clothes to other people, or she would. My dad worked at Halliburton until he retired, and I always felt there was a very strong work ethic as much as caring for other people and feeling a responsibility to the community. And I really felt that I obtained that from both of my parents. I chose a career in medicine because from a very early age, I was familiar with hospitals and physicians, not because my parents were, but because we lived about 2 blocks from a hospital that was named Lindley Hospital. And at that time, in most of the United States, a lot of the hospitals were very small hospitals that were run by family physicians, and that happened to be the case in our community. And my personal doctor was Dr. Lindley. His hospital was just a few blocks from our house, and I can remember going over there when I was sick. And I can remember how personable he was and how I actually enjoyed going to see him. Not because I enjoyed being ill, but I just always thought he was really a kind, personable man. And I think I thought at that time that would be a really good occupation. And so I have been interested from that perspective in medicine for a long time. My initial specialty was pulmonary medicine. And at that time, pulmonary medicine mainly did involve intensive care work and taking care of people with chronic respiratory diseases. A lot of my initial training had to do with trauma, and I enjoyed taking care of really sick people that you could really help, that might come into the hospital in an ambulance and actually be able to walk out. I felt a great deal of enjoyment from that and maybe even satisfaction. So I was drawn to it for that reason. I ended up, however, about 25 years later, becoming very fascinated with sleep medicine. Sleep medicine was a field that very few people knew very little. I should say very few people knew anything about. And I became interested in it in the early 90s. And the very first course that I took, I became really interested in sleep, because it was a new field, it was challenging, it was something that was completely different than what I had been doing. And on the other hand, it had some advantages in that you had a little bit more control over your life. One disadvantage to pulmonary and critical care is that you don't have as much control over your time and your life as you do when you're in a more structured field. So it was a combination of being in a more structured, predictable environment, and also to me it was fascinating. I've been in medicine in one form or other since basically 1970. And for a large part of my practice through the years, I've been in private practice. And the last 15 years, I've been in a practice that I have been completely by myself, not only responsible for taking care of patients, but also responsible for running the sleep lab and being responsible really for all of the obligations of that. And I was attracted to this system because I wanted to transition to a system in which I could focus purely on taking care of patients, listening to them and their needs, as opposed to having to worry about some of the administrative items as well. One thing that I like to do when I see patients is I like to listen to them tell me about themselves. I like to find out where they're from, what they do, and I like to spend time finding out a lot about them. And in sleep, really, you have time to sit and listen to people. For one thing, in sleep, it's really important to know what people's schedules are, and it's important to know what their occupation is. And I know to a degree it's always important in medicine, but in sleep it's particularly important in understanding what their sleep habits are and how it affects their life and how it impacts their life. And so to me, this field is fascinating in terms of getting to know people better. But also what I enjoy about it, what I feel committed to, is understanding what people's or patients' needs are and how those needs are reflected in their daily life.